Hi, I'm Dr. Sridhar Kalyanasundaram, consultant neonatologist and pediatrician working at Dubai. In this video, we'll have an overview of our immune response and vaccines. The aim of this video is not to give you a thorough knowledge of all the vaccines, but to give you an idea of how the immune system works and why vaccines are important. We'll have a little overview of the individual vaccines as feasible. Our body is created and there are complicated tools in our system. Fighting infections is one of the defense mechanisms we have, and we have different lines of defense. We have something called the innate immunity, which is surface built, ready to respond. It doesn't need any memory reaction. So the skin is one of the linings of the innate immunity, the mucosal lining, the cells which are naturally present, which kill the attacking pathogens. These are part of the innate immunity. We have the adaptive or acquired immunity, where we have both passive and active process. A passive process is where we are given an immune product, and this starts from the womb. So when the baby is in the mother's womb around 28 to 30 weeks onwards, mother's IgG antibodies, which are a type of immune factors, cross the placental barrier. So the size of this immunoglobulin is adequate to cross the placental barrier and go across to the fetal side. It circulates in the fetal blood. The quantity keeps increasing, and as the baby approaches term, they have a reasonable quantity. This stays in the baby system till the baby is 4 to 9 months of age. So it depends on the half-life, and it keeps reducing with time. And as the baby gets older, this immune response keeps waning off. So whatever the mother is immune and she has IgG antibodies against gets passed on to the baby, and the baby can oppose it in the beginning. So this is nature's way of ensuring, in addition to breast milk and its protective factors, that the baby survives the vicious obstacles we face in life. Another example of passive immunity is where we get bitten by a dog who might be carrying rabies virus, and then we give the immunoglobulin for that. Snake antivenom, if you are bitten by a specific type of snake, we have antibodies to that venom, and this is a type of passive immunization as well. So passive immunization only lasts for a certain period of time. Once you give the immunoglobulin, it lasts for a few weeks, and it doesn't protect you for life. It is for an immediate response. And another example of that is in neonatology, we give the immunoglobulin for respiratory syncytial virus, or RSV, in the premature babies with chronic lung disease or significant heart disease babies. So this immunoglobulin protects them from getting the virus for a 21 to 30-day period. So it needs a monthly injection. It's very expensive because of the way it's produced. We also have a non-specific product called human immunoglobulin, or IV immunoglobulin, IVIG, which is used in specific conditions. In newborns, it can be used for neonatal jaundice. It can be used for isoimmune hemolytic jaundice. It can be used for thrombocytopenia. In older children, it can be used for Kawasaki disease, immune thrombocytopenia, and various other conditions. Active immunity is where you give a chemical stimulus, usually a protein antigen. Sometimes if it is not a protein antigen, we may need to couple it in the form of conjugation to a protein containing compound, and this stimulates the immune recognition cells in the body, in the lymphocytes, and the B lymphocytes are sensitized to produce antibodies to that specific reaction. So first you get sensitized to that antigen, and then the memory is formed in the T cells, memory T cells. Then it gives a response to the B cells, which start producing the appropriate antibodies, and a memory B cell clone is formed as well. So the vaccines are basically an active form of immunity. We give the antigen which is supposed to react in a way that gives protection against that particular infection. Multiple studies go into this experimental stages. Now we are discussing the coronavirus vaccine, and all of us are reading in depth about how difficult it is to make a vaccine to a virus. Influenza vaccine is an example where every year we need to produce a new type of vaccine because the virus keeps changing, and even though we are trying to keep on top of it, the vaccine efficacy is not that great. So there are different diseases to which vaccines have been produced, and most of them have been very successful, very helpful. The government schedules usually bring in the vaccines which are most important and cost effective. There are always optional vaccines which the families can choose to take. Coming to the question of immunity, is there something that you can do to boost your immunity? So we have healthy living, active lifestyle, healthy foods, minerals, trace elements, vitamins, all of these are important to maintain your nourishment. So adequate rest is important as well. A stressful lifestyle may affect your immunity. Smoking, for example, may affect your immunity. Passive smoking in the case of children may affect their immunity. And vitamin D has been linked to immune response as well. So healthy lifestyle, avoiding exposure to toxic chemicals, and adequate food, water and exercise should be enough, and living in a healthy area without much pollution or contamination. If you are immunocompromised due to any reason, suppose you are getting medicines which affect your immune response, suppose you have a condition which affects your immune response, you may be having congenital immunodeficiency conditions which make you highly sensitive, you may be having blood cancer which needs treatment, that also lowers your immune response. So anything that causes a blood abnormality which affects your immune response can cause compromise of the immunity, but these are very rare instances. Can medicines boost immunity? It's not very evidence based, and there are situations where giving a certain component may improve your immunity if you are deficient in it. But for healthy individuals, as I said, healthy lifestyle is a mainstay. Maybe vitamin D supplements if you're deficient is appropriate, but vitamin C, for example, uh, doesn't have any evidence base, though people give it for reducing common cold and so on. Vaccines that we give, they are followed in a regular schedule. The government gives us a schedule, and then we follow recommendations of other bodies in providing the optional vaccines. So starting from birth, we have the BCG vaccine, which is given in all the developing countries and some parts of the developed world, targeting populations from the developing countries. So BCG protects against tuberculosis. Polio vaccine as oral drops is given in the developing countries, while in the developed world, oral polio is not that commonly used, though 1 or 2 doses may be incorporated in the schedule for the herd immunity, because the oral polio is a live vaccine, and by spreading to the community, there may be a herd immunity, which means others in the community may get the vaccine virus, and that may keep the wild virus away. So we have hepatitis B 0 dose at birth in the schedule in UAE, and hepatitis B vaccine is meant to protect against type of jaundice which happens from bloodstream or body secretion contamination. If the mother has hepatitis B or she is a carrier, the baby may get infected, and the infection is very serious in babies because it leads to long-term chronic carrier state and liver failure or cirrhosis in the later stages. So there is very high chronicity rate if the baby gets it, and that's why we test the mother's blood for the hepatitis B as well when they are pregnant. If in case we don't have that result, we ask to test for it when the mother is born on an urgent basis, because we do have passive immunity to prevent the hepatitis B coming to the baby. That's called the hepatitis B immunoglobulin. When the baby reaches 2 months of age, we have the next vaccine. I would like to mention that I've made a separate video on BCG reaction, so go over it to understand what happens after the BCG vaccine. It's a live vaccine as well. The 2nd month vaccination targets multiple diseases. So we have the hexa vaccine, the hexavalent vaccine. There are different brands which make them, and it includes diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza B, which is a type of bacteria which causes pneumonia or meningitis in early stages, and it includes injectable polio. You also have pentavalent forms and tetravalent forms, with 1 or 2 of these which may be removed. These may be used for later doses, or if you want to give the pentavalent which doesn't have the injectable polio and give the oral polio drops instead, that is an option. The pneumococcal vaccine is different valencies are available depending on the number of strains that is there, and most of us use the 13-valent vaccine. The rotavirus vaccine comes in different formulations depending on the number of strains it contains, and there are slight advantages and disadvantages of each version. So the rotavirus vaccine is peculiar in that it has an age range within which it has to be completed. If you don't start the vaccine before 15 weeks of age, you cannot give the rotavirus vaccine because side effects may be more severe, and serious side effects like tummy concern called intussusception might happen. Same way, if you don't complete the schedule by end of 7 months, you don't give further doses. Number of doses of the rotavirus vaccine depends on the type you use. There are vaccines where you give 2 doses, and there are vaccines where you give 3 doses. Subsequent to that, in the developing countries, we give the measles vaccine at 9 months. As I said, the passive immunity from the mother goes away by 6 to 9 months of age, and measles is a serious disease. It affects more the malnourished people, and it causes further protein energy malnutrition. It predisposes you to a vicious cycle of malnutrition, more infection, and more suffering. So those who are traveling from here to India or Philippines or other developing countries may need to get the measles vaccine as an additional dose before they travel if it is after 9 months of age. The schedule here includes the MMR vaccine and the chickenpox vaccine at 1 year. MMR covers mumps, measles, and rubella vaccines. All 3 are live vaccines, and chickenpox is also a live vaccine. That's a varicella vaccine. All are given at 1 year of age, and they are given into the subcutaneous layer of the skin. It's not intramuscular injection, so it's less painful. We may face a rash after 10 to 14 days of this vaccine. It's not unexpected, and the rash may be just a reddish spot on the skin all over, or it may mimic the rash of chickenpox. Because it's a vaccine virus which is producing it, the signs and symptoms associated with it are mild, and it usually resolves in 3 to 4 days. So you don't need any specific treatment. If there is fever, you can give paracetamol. If there is itching, you can apply calamine lotion or moisturizer, and just supportive care is adequate. However, if you have immunocompromised people in your family, the live vaccines like this should be avoided, and you should take extreme precautions. So the family would have been updated by the doctor managing that immunocompromised child on the precautions to take, because the viruses may spread during this phase of the reaction, and immunocompromised people may get serious disease with the vaccine virus even. Same reason, once you have been diagnosed with HIV or other immunocompromised conditions, you may not get these vaccines after the diagnosis. After the 12-month stage, we have the 15-month booster, which currently has been removed by the government, but we still recommend giving it if we can. That's a pneumococcal booster. And at 18 months, we have the Infanrix, which is a DPT, Haemophilus, and polio boosters. The hepatitis B dose is not here in this stage. We have the MMR booster as well at 18 months, which was a recent addition. The next routine vaccine comes at 5 years of age, and in between you have the option to have the optional vaccines. A hepatitis A, for example, is a water and foodborne type of jaundice, which is very common in the developing world, and we may consider giving that. Meningococcal vaccine, again, it's controversial as to what age it has to be given. Different countries give it at different times. In UK, for example, they have the meningococcal C and B given earlier in infancy. The one we have here is a ACWY vaccine, which covers 4 important strains, and because Saudi Arabia is an endemic area, many pediatricians in the region feel that it's important to give it at an early stage. You can give it as a single dose after 1 year of age or at 2 years of age, depending on which strain of the vaccine you are using. The important factor about the optional vaccines is that they are not covered in the insurance, and you may have to pay for it. You may discuss with your pediatricians. The influenza vaccine is a seasonal vaccine which is given on an annual basis. Again, you discuss with the pediatrician about the pros and cons of giving it, until what age you want to give it. You may target a certain age group, say under 5, or children with complicated diseases like asthma, diabetes, and so on. Or you may give it to everyone in your family, depending on how protected you want to be. And we have a typhoid vaccine, which has different formulations. The formulation which is the current one in developing countries which is a conjugated form, is recommended as a single dose, and that's not available still in the UAE. The one in UAE we have to give every third year as injections. Vaccines can have side effects, and most of them are mild immediate side effects like fever, pain, which may last for 2 to 3 days, and giving paracetamol or similar medications to reduce the fever and observation should be enough. Some local tenderness and swelling may happen. Serious side effects are not very common, and certainly vaccines are an important part of our routine. When we were training about 20 years odd ago, when some of the vaccines like the pneumococcal vaccine and the Haemophilus vaccine were not introduced, we used to see serious complications, brain infection, pneumonias causing death, meningitis with frank pus coming out of this, and cerebrospinal fluid. We don't see them anymore because of partly the hygiene reasons, but also because of these vaccines being so effective. And hepatitis B is declining as well. Many countries like China are endemic for it, but the rate of infection is reducing thanks to vaccination. So breastfeeding and vaccines are crucial parts of the immediate support to the immune response, and obviously as parents we have a responsibility to complete the vaccinations and keep an accurate record, because many schools may require that as well. Premature babies lack the passive immunity, and that's an important aspect we need to see. They need the vaccines on time. We don't go by the corrected age, we go by the normal age. So if a baby is born at 28 weeks, we can still give them the vaccines at 60 days of age. We don't wait for them to come to term and then another 2 months from that as the rest of the babies would have. So I hope this video is useful for you. If you have any questions, you can mention in the comment section, and I would request you to subscribe and share, as it's an important topic. Thank you.